I had a patient, she's 65. She's so funny. She came in and she's like, my vagina feels so young. My libido is so high. Does this vaginal cream do that? And I'm like, part of it, yes. And that's fantastic. You know, she's just like, such a young vagina again. That's what she told me. And I was like, I'm so happy for you. I'm proud of her. I know. I'm happy for your vagina, you know? Good for you.
Yeah, for sure. I'm Susan Yara, and welcome to my life online. We're going to have a lot of fun and learn a lot together. As soon as I turned 40, I started to get hit with all the perimenopause content. And even though I wasn't exactly feeling symptoms for it, I thought, you know what, I'm going to handle this right away. Especially because I truly believe that the celebrities we see who we think look the best as they're aging, I think that they have handled a lot of their symptoms of perimenopause and menopause, along with any of the plastic surgery or cosmetic treatments that they're getting done. They're also optimizing their health and their wellness. But it turns out it's really hard to find experts in the fields of functional medicine, hormones, and especially with perimenopause and menopause. That's why I'm so excited for today's guest. Her name is Mercedes Deal. She's also known as Mimi. She's a nurse practitioner and Menopause Society certified practitioner, and she helps her patients every single day in her clinic here in Miami. In today's episode, she shares how we can optimize our health, our hormones, and think about menopause so that we feel good at any age. Mimi, I'm so excited for you to be here.
I'm so excited to be here with you.
This topic, HRT, which is hormone replacement therapy, perimenopause, menopause, I feel like it's had this popularity growth. I feel like it's just been such a big topic on social media, but I've gone to my OBGYN because I see all these TikToks and stuff, right? And I'm like, oh my gosh, that's me. I'm the person that's in perimenopause. I'm in my early 40s. That must be what's happening to me, right? And then I go to my OBGYN and she's like, you're too young to be thinking about this. She does have patients apparently that are on it, that are like celebrities.
Right.
And we can all think of celebrities that use like olive oil and stuff like that on their skin to look young.
We can definitely identify that.
Yeah, but there are signs, right? Like we can see, just like there are signs when people are on Ozempic, not that it's a bad thing, but there are signs. You just know when they're doing something different that's helping them.
That they're getting a great result from.
And one of the things that I've noticed is if you see a celebrity who's in her, especially like in her 50s and holding on to muscle really, really well, I feel like that's like a clear sign that they're doing something.
For sure.
Right?
Yeah. I think that is one of the most common conversations I have with my patients. I went to my OB, I went to my primary care doctor. I opened up the door to the conversation of hormone therapy and they told me, no, you're too young or it's too risky. And I think that that's an older way that physicians and medical providers were trained. We were terrified of hormone therapy. And thankfully, I truly believe this is because there's more women in medicine. Thankfully, the study that came out in 2000 that scared physicians and medical providers about hormone therapy has been reanalyzed, and we learned that hormones are beneficial. They're not this scary thing that we have to stop giving to our patients. On the contrary, they're so essential that they should be part of every single patient's conversation. Not only for me as a provider, but every provider should be trained from this point forward on how to properly educate patients and treat perimenopause and menopause, because every single person that is born female, every single one, will pass through this same phase.
I know. And what's wild to me in talking to my friends, even talking to my mom, this isn't a conversation that just naturally comes down from the women before you.
No.
You would think, like, I actually only just asked my mom the other day, I was like, Mom, when did you go through menopause?
It's such an important question to ask.
Because it's going to reflect me, right?
100%, yes. Okay. Your genetics matter for when you're likely going to enter menopause. Not just thinking, okay, your hormones and your vagina, because that's what they think about a woman, right? Your hormones affect your vagina, period.
Yep.
That is not the case. It is your brain, your bones, your muscle mass, your teeth.
Oh, I didn't think about my teeth.
Your teeth. Yeah. Women who enter perimenopause, start that transition into menopause, their teeth suffer. So dental care is something that needs to be part of your plan.
I had not even thought about that.
100%.
But what you're basically saying is it affects every single part of our lives, right?
Yes.
So it's physical, it's mental, it's how we feel. It's everything. And I think we know this. If you really consider when you hit puberty, right? Your teen years, you start to feel different. You start to be boy crazy or whatever it is, right? Like you start to get acne. I remember I started getting like blackheads on my nose when I was like 13. I was like, what is this? Like, why am I breaking out now suddenly? And this is how you can just see how hormones are affecting you, how you get grumpy. Yeah. Like I know like when the world feels like it's coming to an end, I know I'm about to start my period.
100%.
It's just crazy how hormones can affect you.
Yes. And perimenopause is like puberty reawakened. Ooh. It's puberty part 2.
Okay.
Because when you enter perimenopause, this is the complaint I get from my patients. I'm anxious. I'm irritable. I haven't had acne since I was a teenager. And oh my gosh, I'm breaking out on my jawline, right? I'm breaking out on my cheeks. I haven't had a pimple since I was 13. What is going on?
Yep.
I'm like, well, you're entering perimenopause. And they'll tell me, I went to my provider. They looked at all of my labs, or they refused to look at my labs. They told me everything was normal. And my answer to them is, just because it's common and something that we see doesn't mean that it's normal. And just because your labs look okay doesn't mean that you're not having symptoms that align with perimenopause.
Yeah.
Perimenopause is a diagnosis of exclusion. That means that I tested you for thyroid dysfunction, anemia, autoimmune disease. Those are all negative. Mm-hmm. Your symptoms align with the symptoms of perimenopause. Boom, you have perimenopause and we can treat you. And we have so many options based on what you're ready to do.
Yeah. Well, let's kind of take a step back. I've heard that perimenopause can start as early as your 30s.
Yeah.
Okay. So let's talk about this, because I think that when should women be thinking about their hormones, or should they just always be thinking about their hormones?
I think they should always be thinking about their hormones. I wish that when I was 13 and I got my first period, somebody sat me down and told me, hey, this is what is common in women when they get their period. Yep. It's common for us to have cramps. It's common for us to miss days. It's common to hide a tampon in your pocket because shame, right?
Yeah.
You're bleeding.
Yeah.
Right? But that is not normal. What's normal and what should be normal, what we should teach young girls, pain-free periods should be normal. Your bleeding should not be so heavy that you're going and soaking through a super tampon or a super pad on a regular basis. That's not normal.
Mm-hmm.
Common, but not normal. And if we can just start educating young girls about what a normal period should look like and what they can do to support their body's hormones, we will have a generation of empowered women who are entering perimenopause and menopause knowing what feels off on their body, in their body, and what they can already do as far as supplements, diet, nutrition, because they will have been doing it for years.
Yeah. Educating women, young women, when they start their period, they're really starting to experience their hormones raging. And so now we're going into a second phase. When does that happen, the second phase?
Well, I'm sure you know this. Skin, right? In your mid-20s, you already start losing 1% of collagen. Mm-hmm. And that starts going up per year.
And do you think this has something to do with hormones also?
Of course. Okay. We're all related, right? We have estrogen receptors in our nose, like from our nose to our toes. Our whole body is covered.
From our nose to our
toes, we have estrogen receptors. So the fluctuations in hormones affect all of that.
Yeah.
Really, the journey starts in your 20s.
Okay.
But most of us are busy enjoying life, so we don't think about preventative medicine at that point.
Yeah.
And then in your 30s, you start losing about 3 to 8% of your muscle mass.
This is the biggest thing that I think I've noticed in my 40s is I went from, I was athletic in high school, right? I was in sports, had muscle so easily. And then I remember being in my 20s and I would skip working out for like 2 weeks and I'd be like, it doesn't matter because I'm going to hit the gym and it's going to come right back. Mm-hmm. And it would. And then I got to my 30s, started to slow down. I'll say in my mid 30s, when I decided to get pregnant and have my first child, the comeback from the first child, I was in really great shape.
Yeah.
But it all went downhill from there.
Number 2 is so hard to come back from.
It was so hard to come back from number 2. I looked pregnant immediately because the body just remembers immediately. And then after I had my baby, the second one, working out became so hard. Granted, I have all of my autoimmune stuff, like my Hashimoto's, but the biggest thing I started to realize was that it was so hard, especially now, to hold on to muscle.
Absolutely. And it's not your fault. We have 2 things working against us. Number 1, in your 30s, your muscle mass starts going down. Number 2, in perimenopause and the menopausal transition, a woman's metabolism will slow down. Mm-hmm. So much so that you burn about 250 to 300 calories less per day. So we have to combat that with strength training. Right. It's not about being tiny. It's not about being skinny. Work on being strong. Build your muscle, build your body, strengthen your bones. You will love yourself so much more when you can see what your body can do instead of focusing on, will I fit into those size zeros? Who cares?
Yep.
I'm like, give me an 8, give me a whatever. I don't care. Give me a 12. I joke around. I train for my old lady body.
Yep.
And I tell my patients, we're going to get you ready for your old lady body.
Yep.
A side effect of that is that you may look and feel fantastic on this journey, but that's not the goal.
Yep.
You know?
When should somebody consider coming in to see you? It probably isn't really age dependent. It's really how they feel, right?
Yes, absolutely. Exactly. It doesn't matter how old you are. I have patients who are in their 20s struggling with PCOS who have been told just go on the pill. Mm-hmm. And they don't want to go on the pill. They want to understand why. So we do root cause medicine. We figure out what is going on that's causing your symptoms, right? And so my patients range anywhere from 20 to 89. Wow. I have an 89-year-old patient. Yeah. Okay. So, it really depends how you feel. What symptoms are you having? Are you having joint pain? Are you having brain fog? Are you having hot flashes? Mm-hmm. Women who experience hot flashes, something we call vasomotor symptoms, they're more likely to have negative outcomes when they enter menopause as far as cognition, brain function, heart health. We've seen that in the studies. Mm-hmm. Also, women who struggle with anxiety and depression or postpartum depression, mm-hmm. They are more likely to experience depression and anxiety in that perimenopausal transition. So I educate my patients. I arm them with the tools because they are the drivers of their health, and you should be the driver of your health. Mm-hmm. You're the boss. You drive. It's your body. Yep. I'm your GPS. You tell me, Mimi, I want to be strong. I want to have more energy. I want to have libido. I want to stop getting UTIs. And I'm going to say, hey, Susan, these are a few routes we can take. What feels good for you? And that's how I think medicine should be.
Yes, completely. The reason I feel really lucky not lucky that I started getting autoimmune diseases in my 20s, but that I started to address it in my 20s. Because of that, I found more functional medicine. And because my endocrinologist they were doing the normal stuff, right? Like they were kind of like, your thyroid hormones are just kind of low. Right. But then you go to a functional medicine doctor or to someone like you, a nurse practitioner who has really made this their focus, and they'll look at things that that your regular doctors are normally looking at. Right. And they'll see it differently and explain it to you and then maybe put you on different medicine. One thing I do want to talk about with you is kind of walk us through the routine. Like if somebody were to want to come see you, mm-hmm. why would they want to come see you first off? And then just take me through what would an appointment with you be like?
So first, I want to preface this with the fact that I truly believe that I want to help other medical providers too. So something that I'm also passionate about is helping other medical providers learn everything that I know. Yep. I teach because I'm only one person. Yep. I run a small boutique office here in Miami. Yep. I have big dreams, but hey, right now, this is me today. I'm in Miami and I'm helping my local community. Yep. I love it. But I want to help other medical providers so that we can help more people. Because if everyone could get this level of care, I think we'd live in a much happier world.
Yes. 100%. Yeah. Less grouchy.
Yes, for sure. Less anxious.
More sleep.
Oh, so good, right? Yes. So the first step is when someone wants to come see me, they book something called a discovery call. It's like our first date. So I like to have this initial interaction with my patients, whether virtual or in person, where we make sure that we're a good fit. Okay. I want to make sure that I am the right person to help you and that you are the right person who could benefit from the help I can give. And so we do our discovery call where we talk about your pain points. What's going on in your life? Like, why are you seeing me? And the most common thing that I get in my door are people who have been everywhere, are not getting answers. They don't feel heard. They honestly feel a little gaslighted. They're told like, you're normal, you're fine, everything's fine. Yep. They come to see me. And then I'll end up ordering a very extensive panel of labs that usually is not covered by insurance. Yeah. Because it's a deep dive.
It makes me feel terrible whenever I talk to people about the types of, I see my regular doctors, obviously. There are things that you still should be seeing your regular doctors for, right? But that's covered by insurance most of the time. But whenever I see people like you, it's then not covered by insurance, which it's unfortunate because it is kind of a privileged place to be able to order some labs that are extensive and that are not going to be covered by your insurance. But it's so important to invest in this. Yeah. Right?
Yeah, absolutely. It is just that. It's an investment. I have patients across all walks of life, across, all income levels. And it's what you choose to prioritize as far as an investment. And I do my best for my patients to find affordable labs so that the testing is not so astronomical. It's actually cheaper than if your insurance doesn't cover it. But all of my labs that I do for my patients, everything. And I'm talking extensive. You'll get this once in your life.
Yeah.
This type of extensive lab work.
Yeah.
$600.
Oh, okay.
You know?
Yeah.
It's not that crazy.
Yeah. And I do want to point out to people, again, $600 I know is not, it's for some people that could be a lot of money. I started doing stuff like this when I was about 28 and I was broke.
Yeah.
I was broke. And I remember feeling how painful that was to spend the money. But when I look back on it, it was completely worth spending that money to get ahead on my health.
Right.
And feeling better.
Yeah. And I think that's when it's a worthwhile investment. So you'll come in, you do the initial discovery call. I send out blood work. You get your labs done. When everything is ready, I have a blueprint ready for my patients.
So you're looking at it ahead of time before they even come
look at it ahead of time because I want to give them options.
Yep.
We need options. We need choices. I'm not going to have you just do what I think is best.
Right.
I'm not living your life every day. I don't know what your challenges may be on a daily basis. Maybe you don't have the time to exercise, really. Maybe you really cannot exercise. That is not, in this point of your life, that's not a priority. That cannot happen. And so we need to prioritize different things. And exercise is part of the prescription for my patients in some cases.
Are you testing for hormone levels too?
I do in almost all of my patients, but in my younger patients, I may not.
Okay.
Hormone levels change. They fluctuate. Knowing your levels are a tool for your treatment for me. They're a tool that I use in treating my patients. So testosterone is amazing.
Yeah. You know, and testosterone gets a bad rap with women because we think we want less testosterone, right? But we actually want a good amount of it.
I mean, it's a good hormone to have.
Okay.
You can abuse it like with anything.
Yeah.
But I'm a fan of testosterone.
Right. It makes you feel sexual.
It gives you more libido.
Yeah.
It helps with muscle mass.
Yeah.
It helps with bone. Now let's talk about the flip side, right?
Okay.
It can cause hair loss if used
Right. This is why we have bald men.
Yes.
Right.
One of the reasons,
Yeah.
right? It can cause acne. It can cause hair growth. And so you need to measure it. So
hair growth where you don't want it.
Where you don't want it. Where we pluck in the car. You know what I'm talking about.
Yeah,
I'm like, do you? I'm like, this is me in my car tweezing my chin. But testosterone can grow hair in places you don't want it.
Yeah. Lose it where you want it. Gain it where you don't want it.
Exactly. Yeah. So I'll have patients when we talk about testosterone therapy, and your levels can be normal, but you could still benefit from testosterone if you have symptoms or you want to try it potentially, right? But I will test your levels.
Okay.
If I put you on testosterone.
So you're looking for testosterone levels.
I'm looking for testosterone levels. I will do hormone. If a patient comes see me for perimenopause, I will do hormone levels on them.
Yeah.
So I'm a menopause certified provider.
Okay.
The Menopause Society does not recommend testing hormones.
Okay.
I disagree. I think they're awesome, but I choose to practice differently. I will test hormone levels in my perimenopausal and postmenopausal patients because I love looking at changes in the labs. And I think my patients really enjoy it as well because I can show them. You came in with your estrogen and progesterone very low and we've been able to increase it. Or your testosterone was very low and we can increase it. I can also monitor to make sure you don't get into the male levels with testosterone.
Right, because we don't want to get manly.
Right. Too much testosterone. That's why you want to make sure to use it correctly and safely.
And with a provider watching you.
Or somebody who knows what they're doing, right? Can cause, clitoromegaly, right? So your clitoris can enlarge, which in some people, thumbs up, right? Some people might like it. Who knows? Like some people are like, okay, I like it. More sensitivity, right?
Okay.
Right? But it could get bigger and it may not go down. It can cause voice changes.
Okay. Horse, like a
more masculine voice.
Yeah.
And so we want to monitor the levels and make sure that you're in a healthy range and that the numbers aren't getting too high and that you're not having negative side effects. And then there's mixed opinions on whether or not we should monitor levels of estrogen and progesterone. I choose to monitor them.
Okay.
There are some studies that show that there are optimal levels in a postmenopausal woman of estrogen in order to have bone protection and cardiovascular protection.
Okay.
I follow that in my personal practice with the knowledge and the understanding. And I tell my patients this is what I'm doing today. It may change if we get new literature out. What I'm doing today might change.
Right. You're going according to the studies that you have out there
right now for my patients.
Right.
Yeah.
I have two questions actually around hormones. One, I was a terrible birth control taker. I got off birth control because I got on it early. Like I was a teenager when I got on birth control and then stopped in my mid-20s because I realized it was making me feel terrible. I felt like I was always hungry. So I was gaining weight, felt like I was always bloated. I felt like I didn't want to have sex. So it actually defeated the purpose of being on birth control. Right. So I just eventually, there were so many different things, right? And so I got off of it. And then that was like the only time that I ever did anything that affected my hormones, right?
Okay.
And so when I hear about HRT, the hormone replacement therapy, I worry that I would be that person that then has like these, like, would I be feeling the same way I felt when I was on birth control?
There are many ways to take hormones, right? And there's oral ways, there's transdermal routes. With birth control, two things. There's estrogen, there's progesterone in them. The estrogen is much higher levels than when we give hormone replacement therapy because we're trying to stop the body from ovulating. So we give it really high levels. So when you're on menopausal hormone therapy or perimenopausal hormone therapy, you'll be on lower doses. The second thing is in birth control, it's something with a progestin as opposed to progesterone.
Oh, interesting. Okay.
So it's different. What we learned is that these synthetic progestogens can actually be bad for our breasts. They protect our uterus, but they're bad for our breast. We're not having these conversations when we're putting patients on birth control.
Right.
But they're always, told that they're bad for hormone replacement therapy. It's going to give you breast cancer. It's going to give you breast cancer.
Yeah.
But it's the synthetic progestogens that are bad for our breast health.
Okay.
They protect our uterus.
Okay.
We need progesterone to protect our uterus. So it's different. It's not going to affect you the same way birth control will affect you.
Okay.
And then oral synthetic estrogens and progestogens, the synthetic estrogens, the oral ones, they increase something called sex hormone binding globulin.
Okay.
So when you have elevated sex hormone binding globulin, it's basically like a net. And it doesn't let your body's free testosterone get out.
Okay.
The higher this number is.
Okay.
So that's kind of one of the metaphors I use with my patients. So when we have lower sex hormone binding globulin, the net becomes looser. And so more testosterone can come out.
Which is a bad thing because...
Which is a good thing.
Oh,
you
it's
want
a good thing.
Lower sex hormone binding globulin so that your testosterone, your free and body available, bioavailable testosterone can do its thing and give you libido. This is why being on birth control takes away your libido. It raises your sex hormone binding globulin, which doesn't allow you to have free testosterone. You don't have as much free testosterone. Testosterone helps us with libido. That is the only thing that testosterone is approved for in women.
Yeah.
Low libido. I know. Hopefully that changes.
That's crazy. Not for their health. It's just it's always sex. It always comes back to sex.
I know. Hopefully that it's going to change. We're more than just sex, right?
Yeah. We're more than our vaginas.
Yes, exactly. Right? Yeah. So number one, we need to have better conversations with women about birth control. It's great for birth control. We need it for birth control. I get it. Right? But we have IUDs. We have different methods that we can use. A lot of my younger patients are using natural cycles and Oura Ring to track. It works. It's 98% effective. 98, 99%
That's kind of what a lot of the birth control is.
Yeah. Right? It's about the same. So it's about knowing what's going to work for you and then understanding what it's going to do. Like it can kill your libido, but with hormone replacement therapy, it won't do that. It doesn't act in the same way. It'll calm your anxiety. And oral bioidentical micronized progesterone is very, very safe. It has not been linked to breast cancer. So there's a doctor, Jerry Lynn Pryor, and she did a study over 5 years with women taking 300 milligrams of oral micronized progesterone, and there were no negative changes in the breast. So we know over a 5-year period, it's extremely safe.
Okay.
We also know that oral bioidentical micronized progesterone is used at very high doses, about 1,200 milligrams, for patients with bipolar disorder to help calm the mania. So I want you to put yourself like in your luteal phase, the 2 weeks before you get your period.
Yep.
You know how you're feeling like, I don't know if this happens to you, but you might feel like a little crazy, anxious,
right now.
stressed.
It's me right now.
Like it's like somebody talks too loud and you're like, the power of progesterone during that phase for a perimenopausal woman, it's like a warm, cozy blanket. It's going to calm you. It's going to make you feel better. It's going to let you sleep at night. It brings you from here to here.
I love that. I love that.
It's so easy.
Wait, can we stop calling it I don't want to call it perimenopause because it makes me feel old.
But you know what? It can actually start in like a woman in her 30s.
I know.
Right?
Well, because it does, you were going back to my mom. Okay. So I have a friend who told me she only found out she's in her mid 30s. She was talking to her mom and her mom said, oh no, I start going through menopause at 38. Menopause, not perimenopause. Yeah. She started going through actual menopause at 38, which is so early in my opinion.
Yeah.
And she was like, Mom, I needed to know this. So would you say that's an important question to go ask your mom? When did you hit menopause? When did grandma hit menopause?
Yes, it's absolutely a question in my intake form. When did mom hit menopause? And a lot of women, we don't know.
Yeah.
And menopause prior to 40 is actually something called primary ovarian insufficiency. It's thought to be an autoimmune disorder. And so people with autoimmune disorders should know if you have one, there's a good chance you have another.
Yeah, I know.
Right?
Yeah, we were talking about this.
A little bit linked, right?
Yeah.
So when a woman enters menopause, meaning 12 months without a period.
12 months without a period. That is what
one
menopause
day. Menopause is one day. After that day, you're postmenopausal. It's like a birthday or the day you're born.
Interesting.
The day you're born and your menopause, one day that happened in your life.
Okay.
It hits 12 months without a period.
Okay.
Women who encounter that before age 40 have increased risk of heart disease, osteoporosis, neurodegenerative disease as well. And it's extremely important for them to start hormone therapy right away. And that's standard practice.
Okay.
So I think if we could just translate that to women who hit menopause at a normal age, around 51, 52.
Is that the normal age?
The average age of menopause is about 51, 52. And you can be in perimenopause 10, 15 years prior to that.
Wow.
Yeah.
That is so interesting.
Yeah.
Well, so, okay, what's the difference then? When you're in perimenopause, what are you experiencing? And when you're in menopause, besides
no period,
right? What are you experiencing?
Okay. So let's start by talking about a regular cycle.
Okay.
In a woman's cycle, there's two main hormones that we'll talk about, estrogen and progesterone. There are times where estrogen is going to be higher, and then there are times when progesterone is going to be higher. In order to get progesterone, you need to ovulate. Okay. So estrogen starts going up and it prepares your ovaries to make an egg.
Right.
That's going to come out and potentially get fertilized for pregnancy or not get fertilized and you'll have a period.
Okay. So that's, you ovulate, then it starts to drop.
Then the egg is released. You're left with an eggshell on your ovary. That's how I explain it. You're left with this little eggshell on your ovary. And that eggshell is responsible for making progesterone.
Interesting. Okay. So
progesterone, the calming hormone that helps us hold pregnancies, that can also give us breast tenderness, is dependent on a healthy ovulation.
Interesting.
So if you're not having regular, healthy ovulations, you're going to have insufficient progesterone. So women don't necessarily need to be in perimenopause to have bad ovulation. We talk about infertility.
Oh, right.
They may have insufficient progesterone due to infertility issues. But in perimenopause, what starts happening is you have erratic levels, very high and low levels of estrogen.
Okay.
Some months you may not ovulate at all.
Interesting. Meaning you don't get your period?
Meaning you get a period, but you don't release an egg.
Oh, interesting. How would you know that?
You wouldn't. You wouldn't. You just feel crazy that month, maybe.
Okay.
Or your period would be late. You can have two periods closer in, days.
Okay.
You can have them more spaced out. What is happening is you're not having effective regular ovulation. So you're not having enough progesterone because you don't have that eggshell to produce the progesterone.
I had no idea how much your egg is affecting your actual hormones.
Yes, big time. It's the driver.
Yeah.
So in perimenopause, you have erratic ovulation, erratic periods, insufficient progesterone.
Okay. That's like the clearest sign.
That's a clear sign.
Because all the lethargic, all that
irritability,
stuff.
anxiousness.
But that could also be something else.
It could be something else. But most women will go see their doctor because they're having increased anxiety. And the first thing is, hey, let me put you on an SSRI. Anti-anxiety medication.
Which is the worst because then you're just numb.
Yeah.
I'm in my 20s, there was this birth control pill that came out that also had the antidepressant in it. They cleared it off the market like 2 years into it, but I was first. I was like, yes, I love that. And I just remember being just so numb. Like nothing made me happy. Nothing made me sad. And I was just like, because it wasn't like I was diagnosed with anything. Right. I just got put on an antidepressant because they were basically advertising it as you'll stop being crazy when you're crazy about to start your period.
It drives me crazy.
Yeah.
It drives me crazy.
It like lowers PMS. That's what it was. PMDD. I remember that. It was like get rid of your PMDD with your birth control.
Yeah. I mean, I have a bone to pick.
Okay.
With like makers of the pill and just anybody who says like women are crazy before their period. I mean, our hormones are out of whack. We're living in a very stressed out kind of time society. And so women don't have enough progesterone on board. Yeah. Like even regular patients who are not perimenopausal, 20s, 30s, I see issues with progesterone production in their bodies. And so I will supplement with that. And I think that we have to stop even as women saying we're crazy.
I know.
You're not crazy. Your hormones are having a moment. Let's honor them. Let's have a little self-love and say like, this too shall pass.
Yeah. Because our hormones are also awesome.
They're awesome. Of course. Yeah. They make our skin glow. They give us the ability to create life.
Yes.
There's so many amazing things that they do. Uh-huh. And we've just been taught that they're shameful and
they make us crazy. And that's the wrong way to be thinking about
Absolutely.
it. We should be honoring them, like you said, and taking care of them. I love 100%. this. I love this thinking. Okay. So back to perimenopause versus menopause.
Okay. In perimenopause, you have this erratic estrogen, insufficient progesterone. Okay. So a patient will have increased anxiety, irritability. It's really so simple. We can support you during this time with progesterone.
Okay.
Now,
and this can be oral or topical.
So oral is the safest, most effective option.
Okay.
I will say there are a lot of people out there who will tell a woman to take topical progesterone.
Okay.
The data is not there to back it up.
Okay.
If you're on hormone therapy, meaning you're taking estrogen, you absolutely 100%, and I'm going to say it with a lot of power behind this.
Yes.
You have to be on oral micronized progesterone.
If you're taking estrogen.
If you're taking estrogen, you have to.
Okay.
Because estrogen is a growth hormone. It's going to cause proliferation and growth, which means it's going to cause growth in your uterus. Everything you shed with your period is endometrium lining. Yep. So it causes the endometrium to thicken.
Okay.
And progesterone calms it down. So if you're on estrogen, you need the balance. And so women who've had a hysterectomy, meaning they've taken out their uterus, some providers will tell them, and this is old school thinking, they'll say, you don't need progesterone because you don't have a uterus, so we don't need to protect it. But we know that progesterone works in the brain. It works in so many other parts of your body. You don't just need it for the uterus. So perimenopause, progesterone. That's what I think. They go hand in hand. Now, a woman doesn't have a period anymore for 12 months. She's postmenopausal. I usually will put her on estrogen, progesterone, and possibly testosterone.
Okay.
It depends. And even I'll put my perimenopausal women on testosterone as well. It just depends. There is no cookie cutter way to do hormones.
Yeah.
That's my only issue with big box factories that try to put everyone on hormones is you lose that personal touch.
Right. I mean, I've seen some of these prescription like skincare companies, even they're doing like estradiol, or is that how you say?
For the face, estradiol for the face.
Estradiol, is that? Yeah. Yes. I know. And I was like, that's interesting. I want to put that under my eyes, right?
But go for it.
But some women,
it's not going to hurt.
Yeah.
It won't hurt. There's zero systemic absorption.
Okay.
Estradiol or estriol, they're two forms that are used topically that don't have any systemic absorption.
Okay.
But they have skin benefits. So as we age, as we lose our hormones, we actually get vaginal tissue atrophy.
Downside. Wait, what does that mean?
I'm going to tell you.
Okay.
I'm going to tell you. Don't be scared because we have a solution.
It sounds
and it's so
awful.
easy. I know.
Atrophy.
I know it is. It could be really awful and you can die from it.
Oh, okay.
And I'm going to say why.
Okay.
Okay.
Tell us.
I don't want to be alarmist, but it can happen.
Okay.
Okay. So vaginal atrophy can happen because you don't have any estrogen.
Okay.
Supporting your vaginal tissue. So you have dryness, you have irritation, you start getting frequent UTIs. And in an older woman, a UTI can kill you.
Yeah. Well, yeah. I mean,
so
it can get painful if you're letting it go, right?
Yeah. So what can we do when you start experiencing this? Dryness is the first sign.
Okay.
And I see this actually in a lot of postpartum mothers.
Yeah.
And so I will liberally prescribe vaginal estrogen.
Okay.
At low doses. Topical. It's a cream, just like you would use it for your face. If your face is dry, if your hands are dry, chances are your vagina is dry. So let's not neglect her.
I know.
Let's add a cream down there, girls.
Okay.
Seriously.
I like this.
It's so safe. Studies with vaginal estrogen show that it is so safe that we, menopause women's health providers are pushing for oncologists and breast cancer survivors to be given this option as well. Because hormones are something that, for like safety reasons, you may not prescribe to somebody who had breast cancer. Some providers do, and I applaud them because there is a way to do it.
Yeah.
That's not me right now, but some providers do. But vaginal estrogen is so safe. I will provide that to my breast cancer survivors because it doesn't absorb systemically. So it's not going to change your blood levels, but it is going to change your vaginal health significantly. I have patients who were getting up at night to pee, frequent UTIs. All we did was add a vaginal estrogen.
They're just like applying it at night before they go to bed or something?
So the way you do it is you're going to get a prescription from a medical provider. Make sure it's right. Make sure you're being
Don't get
correctly.
it on Amazon. Because I've seen people say you can get it on Amazon.
You can get yam cream on Amazon. You can get estrogen cream on Amazon, but what's in it?
Yeah.
So don't do it. Don't. It's so safe. It's so affordable. You can go to like a doctor. You can even find like online menopause care places that are very affordable and you can get it.
Okay.
You don't have to come to see me to do it.
Okay.
Okay. It's a cream. You're going to I always tell my patients, this much on your finger. Get friendly with yourself.
Okay.
Every single day for 2 weeks. You apply it to your vagina, the labia. You're going to go like,
okay.
Don't be shy. Get in there.
So bring it down.
I am like I do it. It's a game changer. After I had kids, like things changed.
Yeah.
So I needed to support my vaginal health. I don't want to get a UTI as I get older. I think sex should feel good.
Yeah.
And vaginal tissue atrophy and dryness affects women of all ages.
Yeah.
Right?
Does it affect the man if you're putting it on and then you have sex
check
after?
this out.
Okay.
This is how
I love this face you just made.
I'm like, this is how safe and non-systemic topical low dose vaginal estrogen is. They did a study of a couple, and like a female put on the vaginal estrogen. She had sex with her partner and his levels did not go up at all.
Okay.
So it will not affect your partner's levels. However, I tell my patients, just do it opposite times. You know, if you're going to be intimate in the evening, put it on in the morning. You don't even have to worry about it.
Right.
But if you are spontaneous and you just put on your vaginal estrogen, don't stress either. My patients report, and I can say on a personal note too, like you feel better down there. You're not going to the bathroom in the middle of the night. You may get less UTIs. I had a patient, she's 65. She's so funny. She came in and she's like, my vagina feels so young. My libido is so high. Does this vaginal cream do that? And I'm like, part of it, yes. And that's fantastic. You know, she's just like, I have such a young vagina again. That's what she told me. And I was like, I'm so happy for you.
I'm proud of her.
I know. I'm happy for your vagina. You know, good for you.
Yeah, for sure. For women that are watching, what are some things that they can just do right now that will improve their lives drastically over the next like 4 weeks to 6 weeks?
For sure. I think the first one is starting with mindset. I want you to love your body. Even if you are not happy where you are in this journey, start with loving yourself today along the journey.
Okay. Yep.
Self-love is so important.
Yes.
Number 1. Number 2, eat. You're not eating enough. You're probably not eating enough.
Protein. This is
protein.
You won't believe how much protein
You have to eat.
I keep trying to eat. I cannot even hit my numbers to be able to like maintain my strength and my muscle and everything. I feel like I think about protein all day long.
So I tell my patients as a general rule, and I set the bar high because I know that sometimes we may fall short. So I have you eat 1 gram of protein per desired pound of body weight. So if you want to weigh 150 pounds, although I think weight is just your relationship to gravity, it really doesn't mean much other than how much gravity is pushing on you. Muscle mass is way more important, but you should have about 1 gram of protein per pound of body weight. So if your goal weight is 150 pounds, you should be consuming 150 grams of protein.
Okay.
So sufficient protein, sufficient calories are really, really important. And you're right, protein over protein.
Yeah.
I think we're hearing it all the time. So be nice to yourself, fuel your body, eat enough protein, move your body in whatever way you can. If that's playing with your baby, that's what it is. If it's walking your dog, if it's going dancing with your girlfriends, move your body. Get rid of the expectation that it needs to be in a gym. Move. And I always say wear SPF.
Yeah, that's
Those
what
are
I say too.
my non-negotiables.
Yeah.
Be nice to yourself, fuel your body, move your body, wear SPF.
Okay, supplements. And if they are going to start working out in the gym, what would be the best things to do? So supplements.
Supplements generally that I can say are safe for everyone. Creatine for sure.
Yeah.
Vitamin D, get your levels tested. Get them tested. It's worth it. And if you need it, supplement. That's really important. Magnesium glycinate is awesome for sleep and nighttime calm.
Glycinate's important because there's also citrate.
There's citrate, which makes you poop.
Okay.
There's oxide, which makes you poop. There's threonate, which crosses the blood-brain barrier. And I personally take that because of my family history of Alzheimer's disease.
Okay.
And it's part of my conversation with my patients. If you have a history of Alzheimer's disease, you may want to take that.
Okay. The one that's in general
Magnesium glycinate.
Glycinate.
It's going to help you sleep at night. And you're going to want to take that at night.
And I find it calms my anxiety.
Yeah, it's calming. It's calming. It's awesome. I don't like to say general supplementation.
Because you should really test it.
You really should.
How about like pre and probiotics?
Okay, so this is funny. So there was actually, I think there's a mixed bag. I sometimes recommend pre and probiotics. I sometimes take them. I sometimes don't. Yeah. I believe in like cycling things on and off. There was this reel going around Instagram at a gastroenterologist conference, and they were asking the specialists whether or not they believed in pre and probiotics. And even in that room of physicians who that's what they do day in and day out, the answers were mixed. Yes, no, we like them, we don't like them. I think that they have their place. I think that not each is created equally. There are better quality probiotics. Prebiotics are really beneficial for everyone. They're going to feed the gut bacteria.
Okay.
Probiotics, I do a test on my patients where I check what bacteria they may be lacking.
So it goes back to labs.
Yeah.
Testing you to see what you actually need.
But there's some probiotics that can support you along your journey. For example, if you have blood sugar regulation issues, there's certain probiotics. And I don't like to necessarily say brands because I'm not really affiliated with any brand, but I'm going to say one now. There's a brand called Pendulum, and they have a blood sugar regulation probiotic that I like to use for patients who struggle with blood sugar issues.
Okay.
And the reason why I like to use it is because they have some data to back it up.
Right.
And I think with any supplement, just because it works for your friend, it might not work for you. So I usually will recommend that you try it out. Give it 30 days. See if it moves the needle for you. Do you feel better? If you do, keep using it.
Yeah.
If you don't waste your money.
Yeah. Okay. In the gym, I was having this conversation with one of my girlfriends. She was hitting those like boot camp kind of classes. Okay. And I used to love those when I was in my like 20s and 30s. But I had this realization that I just needed to strength train.
Yeah.
Just at the very least, strength training. Yeah. What is your thought on this?
I agree 100%. Yeah. My strength training is so important. Building muscle mass is so important. It strengthens our bones. It's going to help you live longer. Dr. Gabrielle Lyon says it's longevity. Your muscle is linked to your longevity. And I agree. I have changed the way I exercise. I used to be a half marathoner. I used to run or jog, and I don't really run much anymore. I focus on strength training and walking on an incline.
I do walking on an incline twice a week.
It's great.
Yeah.
It's all I need.
I actually joked when my personal trainer had said to do this. I was like, wait, so you're telling me all the times I was like judging those ladies that look like they were just like, I could see them like on their phones, even having a conversation while they're on like a massive incline. It looks like they're going slow and not doing much. He was like, no, that's fantastic. Especially for your ass.
And for your heart.
Yeah.
Because you're
I'm like, for your ass. You're like, for your heart.
For your ass and your heart. Because you're walking and talking and it's forcing your heart to work in a different way, basically, while you exercise. And it's I think it's called like level 2, zone 2.
Yeah.
Exercise where you can talk and actually exercise. And that's something we should be doing more of.
Yeah. I love that. I love that. So strength training and incline.
Strength training and incline. Definitely.
Okay. You know, one of the supplements that I keep hearing about and people actually keep asking me about, so it's really making its rounds. I keep telling everybody, I don't really know if there are true studies that show it's beneficial, but I'm curious to hear your thoughts on NAD.
Okay. So NAD, I will agree with you there. The studies are mixed.
Yeah.
And most studies are on its precursors, NMN, NR. That being said, I really believe in bioindividuality. I believe in people driving their health. And so I personally use it sometimes because I feel a benefit. For me personally, in my own use, I feel increased energy, better mood. However, it's something that should be cycled. You shouldn't be on it continuously.
Oh, that's good to know.
And if you have a history of cancer, you should not take it.
Any kind of cancer.
Because
when you say history, not family history, but personal history, like you've had
cancer, you should not take NAD because NAD can cause growth and it can cause cells to divide. And we don't want that with somebody who's had a history of cancer.
Right.
Again, the research is lacking. We could do with more research. But in the space that I work and what I do, a lot of anecdotal evidence or how a patient feels or how I feel on a certain medication guides what I do for myself, what I do for my patients.
Yeah.
I tell my patients just that. We don't know. There's mixed evidence. And what we do know is based on studies with the precursors.
Yeah.
We can take NAD in that form, in precursor form, and it's going to convert in your body and you can try it for a month. Do you feel a difference? You do? Great.
Yeah.
I don't think, and I think there's a lot of people selling snake oil out there, promising the fountain of youth. I will never tell somebody that. We don't know enough. We do know that it can be very safe in the right person. And then people report improvement in energy and mood. And even if it's placebo, I'll take it.
I get that. I totally get that. I actually, because people kept asking me about it, I'm like, well, I guess I'll be the guinea pig. I always am, right? Yeah. I started taking it. I couldn't take the full dosage. I would feel almost like nauseous. Yeah. So I started just taking, instead of 2 pills, 1 pill in the morning. And I do feel the energy. Like it almost feels like I don't need to have caffeine anymore.
That's awesome.
So I do like that.
Right.
Good to know that I should cycle it. Yes. So basically like get through one month on, 1 month off.
Okay. I like to cycle. There's no hard and fast rules with that. Yeah. That's just the way I practice. I cycle things.
And then also injections of NAD or pills versus pills.
Most of the studies are on oral. Pills. People do IV, oral pills. Yep. People do IV. I don't like IV. People take the IV and they say they feel horrible. Why do you want to feel horrible? I don't want you to feel horrible. I want you to feel great. So I'm not going to do something that's going to make you feel bad because you think it's going to make you feel good. That doesn't make it make sense. And maybe I'll do it, but I can't make it make sense. I personally do injectable. I did it today before I came.
Oh, okay.
I'm like, I want it to be sharp. I want it to be focused. So I like injectable because I'm not afraid to inject myself and I get pill fatigue.
Yep.
So I like injectable. There's not a lot of data on it though.
Yeah.
And you have to source it from a safe pharmacy. A lot of people are getting their NAD or injectable peptides from like random internet websites.
Yeah.
That's not safe.
No.
You don't know if the labs are sterile. There's no one checking to make sure these people are doing their job.
Yeah.
So please be careful.
Yeah. Speaking of injectables, we obviously know that like the semaglutides, They're a peptide that's really popular. We've seen how much it's really benefited people. But I think there's something more underground where there are these peptides. The first time I ever heard about it was with friends who were like the fitness models, right?
For sure.
They were taking this for their competitions or to like do a photo shoot or something. And they would just get this crazy muscle mass.
Yeah.
Like they would just look like, they would look like they can just build muscle that you just couldn't believe that a woman could do, right?
Yeah.
So I started hearing about that. But then I recently in the last year, I feel like I know more people who are just taking it because they wanted to, for their muscle, but they don't want to be fitness people, right? They don't want to be bodybuilders. They just are doing it because they want more muscle mass. They want to look better. They want their skin and their hair to look better. What do you think about that? And I know that it's underground, but I'm curious.
No, I'm totally open to talk about it. I love peptides. I think we could definitely use more research. They're very regulated. I wish we had more tools at our disposal. They're a tool in my toolbox that I use for patients. I personally use them in my own health journey. I had breast implant illness. I got my implants taken out and I had surgery, and I used peptides to help with wound healing.
Okay.
There are peptides that help with brain health, sleep, muscle mass, immune system support. There's so many different peptides. There's so many tools in the toolbox.
Yeah.
Understanding the way they work, how they would affect each individual is really important. Making sure they're sourced from a safe place is really important. And I actually really believe that peptides are the future of medicine. Semaglutide is a peptide and it has shown to be amazing. I use it in my practice. I think it's a wonderful peptide. Sermorelin, ipamorelin, these are more peptides that are going to help boost muscle mass.
Okay. I've heard of Livogen and also even like the copper peptides that I use in my skincare line, right? But it's injected. Yeah, I've heard that people do all that.
So I don't inject those in particular, the GHKCU, but I like them topically. I think they show promise. Now, everything that we do could use more research.
Right.
We don't have that right now. Yeah. And if they're relatively safe and my patients are aware, I believe in shared decision making. Yep. We work together. We make a plan together.
And you talk pros and cons.
The risks. Yeah, we talk pros and cons. If you're wanting to try something, I'm going to hold your hand and we're going to do it.
Okay. That makes sense. Well, I bring this up because people talk about celebrities and yes, we talk about their plastic surgery, their cosmetic treatments, but there are these little things they're doing also that they have access to that the average person doesn't think about or know about, right? Yeah. Like these peptide injections. Semaglutide Ozempic was a thing before it became a thing, right? Sure. But this was like in Hollywood and with wealthy people.
Yeah.
And I feel like these peptides are the next underground thing that people, and hormone replacement therapy. Those are actually the two biggest things that I think, again, I go back to JLo. I hate calling her out, but everyone's always like, why does she look so great? And she doesn't want to share anything. I get it. All these celebrities don't want to share their secrets. But I think two of the biggest secrets are the hormone replacement therapy and maybe potentially peptides.
For sure.
Injectable peptides.
I agree 100%. I think they're the future of medicine. And if we can just put more time into and energy into studying them and making them more available for people.
Because they are hard to get.
They are hard to get. Even for medical providers, I have relationships with multiple pharmacies just trying to source these peptides.
Yeah.
One of the peptides that I used after my surgery to recover was something called Body Protective Compound 157. It's no longer available in injectable form.
Wow. Why?
The FDA doesn't let pharmacies produce it anymore.
Why?
I think it's so complex, you know? There's multiple layers to this, and let's not peel the onion here.
I know. I've heard from people, they have to like go to Korea or to Europe or something to be able to get these types of injectables. But that's why it is one of those things that the average person doesn't know about it, because obviously that's a lot of effort and privilege and wealth to be able to get this kind of stuff. So these celebrities are going to different countries. They're going to different countries or having a provider who will source this stuff for them because it doesn't matter what the money is or the time that is.
They're willing to spend it.
Yes,
absolutely. I think they're just challenging to get right now. And I hope that things change, and I hope we're able to access them, because I do believe they're really powerful and a great way to help someone live longer with a quality life.
Yeah, for sure. Okay, so let's talk about some of the things that we see that are social media trends in the like functional medicine wellness world. You said you like mouth taping.
I love it.
Okay, wait. I was thinking this is bullshit, but no. So you're saying no, you love it. Okay,
I love it so much. I can't sleep without it.
Really?
I need to sleep every night with mouth tape.
Okay, tell me why.
Okay, it forces you to breathe out of your nose.
Okay.
So there's a few benefits with that. Now, again, we need more research, but it helps me so much that I will never stop.
Interesting.
Okay, I put a little piece of mouth tape across my lip.
So you're not going crazy. You're not doing like the whole
cover. Gosh, no, because I wear a retinol.
Okay.
So I will destroy my face if I do that. So I do a teeny tiny piece. I put a little healing ointment on my lips before bed, and I put a teeny tiny piece of tape across my lip.
Okay.
So that I can't really open it, my mouth. It forces you to breathe through your nose. It allows you to have a better jaw position.
You do have a really great jaw.
Thank you.
Yeah, that jawline is
Like, it's one of my favorite
snatched
about me. So thank you.
She's like, give me that profile shot.
Thank you. No, so I put a little piece of mouth tape. It forces you to have proper alignment of your jaw, forces you to breathe through your nose.
What's the benefit of breathing through your nose?
For me, it decreases anxiety. Deep, calm breaths through the nose helps to decrease anxiety. You may have a tiny moment of panic when you put on the mouth tape. You might freak out and say, oh my God, I can't breathe. You can breathe. You can still breathe out of the side of your mouth. You're going to be okay.
Okay.
If ever you have a rough night, I've woken up with my mouth tape on the pillow. It'll be okay.
Yeah.
But actually, where we do have evidence is that it helps protect your teeth. Mouth
right.
breathers.
Dry mouth. Yes, you get dry mouth. Right.
Dry mouth gives you cavities, is bad for your oral health.
Yeah.
So I go to sleep with minty breath and I wake up with minty breath.
Oh,
it's fresh.
wait, and now that I'm a single woman, this is good to know. You know, I maybe I need to be waking up.
It might be weird.
Yeah.
You know, like sleepovers and mouth tape, but it's so worth it. No one bats an eye at my house. My kids are like, Mom, where's your mouth tape? You're going to sleep. Where's your tape? They ask me.
I love this.
I'm like, I'm going to put it on a little bit. It's okay. And it seems like such a crazy idea to sleep with mouth tape. But if you try it for a week, I promise you won't look back.
Yeah. You know
Awesome.
what? I'm going to try it. But at the very least, it's harmless.
It's harmless.
Yeah.
What's the worst thing that happens? You give yourself a little wax.
Yeah.
In the morning. A reminder that you're due.
Yeah.
You know? Or something like that.
Exactly. The other one I've seen, I find it so hard to believe that it does anything, but I see so many people doing it now, is castor oil in the belly button. Like I've seen people put patches over it, and like they're talking about how it absorbs and then it helps their gut health. What do you think?
Okay. I don't use it personally because it's not where I'm choosing to invest my energy for my health. But there is actually some data that shows that it's beneficial. Yes.
Really?
It can be, there's an acid that's a derivative of castor oil. But if I said the name right now, I'll butcher it.
Yeah.
But this acid actually topically can reduce inflammation and can change your gut flora a little bit.
Interesting.
But downside, everything has a good and a bad.
Of course.
Downside, it can also cause cramping. If taken orally, it's a laxative and an abortive.
Right.
And
I mean, I've seen prison movies where they use castor oil to get
100%.
Yeah.
So taken orally, it's a laxative. And I will tell my patients, if you're going to do castor oil, don't do it during your luteal phase.
Okay.
Why do you want to cramp?
Yeah,
if
like
you're gonna
double
have
up on your
effect. So you can do it. There's no harm. For me, it's just not where I put my energy right now.
Yeah.
But for somebody who has like an abundance of time and wants to do all the things, I don't think it'll hurt you. And it can reduce inflammation. There are some studies that show it.
Can it actually absorb? Like they're putting it specifically into their belly
It
button.
must absorb a little bit.
Okay.
I wouldn't do, I guess you could do the belly button. When I do it, because I have to try it.
Yeah.
I'm not going to lie. Everything that's out there, I'm like, I'm going to try it.
I do too.
I have to try it. So I tried it. I've gotten those like self-adhesive patches.
Yeah, that just kind of go across the belly.
Yeah. It didn't move the needle enough for me.
Yeah.
I chose to take a probiotic instead, or I chose to do different anti-inflammatory protocols. There's just so many tools in the toolbox. So I pick and choose.
I could sit here talking to you forever. So maybe maybe next time we'll be like, gather questions from the viewers, and then we will come back and just answer so many questions, because I know there are going to be so many questions after this.
I would love it. This was so much fun.
Thank you so much.
Thank you.
Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.